Dr. Kate Utek with New Journey Physical Therapy. We are a PT practice in Highland Park, Illinois, specializing in perinatal and pelvic floor physical therapy. Today I'm going to talk about 360 breathing, bearing down, and how those relate to pushing your baby out. So if you do not have an epidural, you will feel the fetal ejection reflex when it's time to push your baby out. And then you can just follow that breath pattern, your instincts to push your baby out without having to do any conscious pushing. But in the case of an epidural, a birthing person does not experience a fetal ejection reflex, and therefore it's helpful to practice a more natural pushing technique so that in the case of an epidural, you can use a gentler, more natural pushing technique in order to reduce rates of tearing, reduce stress to the baby, and improve overall maternal and baby outcomes. So you're going to start sitting up really nice and tall. I'm sitting so that my vagina is pointed down, so that my sit bones are slightly behind, and I have a triangular base of support. In this position, I put my rib cage over my pelvis, ideally. That's going to help me to take a really nice deep breath where my rib cage expands in the back, the sides, and the front. When I do that, I feel my pelvic floor drop down onto the chair on inhale and come up a little bit on exhale. I am not pushing or contracting my muscles actively. I'm just feeling that the pelvic floor is relaxed and moving naturally with an inhalation and exhalation. Just gentle movements down on inhale, up on exhale. So I'm going to take a few breaths. I want you to watch my belly too. The belly moves at the same pattern as the pelvic floor. Out on inhale, in on exhale. Watch my rib cage too. You might be able to see a little bit of that movement backwards and frontwards. You're not going to see the sides because of the camera angle. So when I breathe that way, I can feel that my pelvic floor is really relaxed. Then we're going to utilize that breath to help practice the pushing technique. When we push, we want to push for 5 to 7 seconds and then stop, take 2 to 3 breaths, and then push for 5 to 7 seconds again, take 2 to 3 breaths, and then another 5 to 7 seconds. So that in one contraction, you can fit in 3 times of pushing for about 5 to 7 seconds each. You may only, if your contractions are a little bit shorter, fit in 2 cycles during actual labor. We want to practice that for 3 so you have that experience for both. We do not want to be pushing for 10 seconds. We do not want to be pushing so hard that we are bursting blood vessels in our eyes or holding our breath. So the way this is going to work is a gentle inhale. I feel my pelvic floor drop down and my belly come out just like I did when I was just breathing. And then I'm going to keep my belly hard on exhale. Inhale, exhale. Inhale, exhale. Inhale, hard belly, exhale. Inhale, exhale. Inhale, exhale. Inhale, hard belly. So that was 3 cycles. I was counting in my head for the actual pushing time as I did that hard belly push, keeping my belly hard. I felt my pelvic floor drop down for 5 to 7 seconds as I exhaled. Hope you find this helpful, and thanks for watching.